We are considering item 14.1 of our agenda, appointment of the Regional Director of Africa. I should like to congratulate you, Dr. Matshidiso Rebecca Moeti, on your appointment as Regional Director for Africa for a period of 5 years, as from 1st of February 2015, and to convey our best wishes for your success in all your endeavors in the region. Dr. Moeti, may I invite you to come forward. Dr. Luis Gomez Sambo, may I ask you to come to the front of the board. Dr. Sambo. Thank you. I shall now invite Dr. Moeti to stand up and take the oath of office.
I solemnly swear to exercise in all loyalty, discretion, and conscience the functions entrusted to me as an international civil servant of the World Health Organization, to discharge those functions and regulate my conduct with the interests of the World Health Organization only in view, and not to seek or accept instructions in regard to the performance of my duties from any government or any other authority external to the organization.
I witnessed her to sign on the dotted line what she had done. And in accordance with the instruction by the Executive Board, I was authorized to give Dr. Moeti an appointment for the next 5 years as Regional Director for Africa. So think about it before you signed it again.
I've thought about it a lot.
Go ahead. There are 2 copies of this letter, and of course, one copy will be given to Dr. Moeti, and as DG of WHO, on your behalf, I will keep the other copy. Thank you. Chair,
Thank you, Madam Director General. Congratulations, Dr. Moeti, who I invite to say a few words now. Dr. Moeti, you have the floor.
Thank you very much, Chair, and good morning, honorable members of the Executive Board. Chairperson and distinguished members of the Executive Board, Director General, Dr. Margaret Chan, Regional Directors, ladies and gentlemen, and colleagues. I'm deeply honored by the decision of the Executive Board to appoint me as a WHO Regional Director for Africa. I'd like to thank the member states of the WHO African region and the Executive Board of WHO for giving me the opportunity to lead the region and to work with our member states to give new impetus to progress towards our common goal of making better health for Africans a reality. I also thank the government and people of Botswana, my country, for their support for my work, candidacy, and campaign. I take up my new position in all humility, fully aware of the challenges that lie ahead. Allow me to introduce myself briefly. I've worked in health for more than 35 years, about 20 of which have been at international level. But the basis for all this was laid by my background as a child, being the daughter of 2 physicians in then apartheid South Africa, living in a township near Johannesburg, with my parents among the few doctors providing services to a community living in poverty and deprivation. My understanding of the need for justice and fairness in health grew out of the daily observation of the struggles of families to stay healthy, since the consulting rooms were in an extension of my parents' small house. It was consolidated by all that I have learned working in the public health system of my adoptive country, Botswana. I have since then had the privilege of occupying positions of increasing responsibility at the country, regional, and global levels in WHO, UNICEF, and UNAIDS, following my experience in Botswana's public health system. I've been privileged to work with a range of programs covering the Millennium Development Goals, and also as a director of non-communicable diseases, an emerging problem in our region. In the recent past, I've worked as a deputy regional director in WHO Afro for 2.5 years under the leadership of Dr. Louis Sambo. The year 2015 in which I take office is a very significant one. During this year, we shall assess how well countries have been able to push themselves in meeting health targets. It is also the year that we conclude the planning and launch the post-2015 development agenda. The African region has made considerable progress over the years, although there remains much to be done. Significant declines have been seen in the incidence of HIV, tuberculosis, and malaria. A number of neglected tropical diseases that have plagued this part of the world for centuries are close to being eliminated. Immunization rates have soared over the past 10 years, and deaths from measles have plummeted. And Africa now has a new vaccine that promises to make outbreaks in the meningitis belt a thing of the past. There have also been declines in maternal and child mortality, with some African countries showing the fastest rates of decrease in the world. However, the region continues to face several challenges. For the past months, the Ebola virus disease epidemic in West Africa has been the top priority that has engaged us all. This tragedy has had a devastating impact on families, livelihoods, security, and socioeconomic development in the severely affected countries. It compelled a response that went well beyond the health sector and the actions of ministries of health and WHO, and is demanding the investment of millions of dollars to ensure that the rest of the region and the world are prepared to limit any spread should cases occur. I'd like to respectfully pay tribute to the governments of Guinea, Sierra Leone, and Liberia for their leadership and steadfast action in responding to the epidemic, and to the people of these three countries who've shown extraordinary courage and adaptability in facing up to this completely unknown threat in their midst. There's been an unprecedented outpouring of support from across the globe, from African countries and the African Union, from development partners, from non-governmental organizations, and philanthropists. The Executive Board's special session on Ebola emerged with a bold and comprehensive resolution that articulates a very clear agenda for action by member states, by WHO, and by development partners. I'm committed to working closely with Dr. Margaret Chan, with colleagues in our headquarters and the regional office, to ensure that we deliver effective and timely WHO support to the countries working within the coalition led by UNMIR. After months of extraordinary effort by the governments and people of the three countries and partners, including WHO, the tide appears to be turning in the epidemic. However, we will need to sharpen our vigilance and focus on finding and tracing all chains of transmission, treating all those who are infected, and achieving 0 cases in each of the countries. This means putting field epidemiologists, data managers, and contact tracers on the grounds in the required numbers, working side by side with skilled community mobilizers, and definitively confirming this progress. My most urgent task as I take office will be to help the affected countries in their efforts to get to 0 cases. I'm equally committed to providing the technical support and advocacy needed for these countries to rebuild their health systems, which have been destroyed by this unprecedented epidemic, and following up on the work that I know is already ongoing between headquarters and regional office staff. I intend to strengthen the capacity of the WHO Secretariat in the African region to lead and coordinate our preparedness for the response to epidemics through budget reallocation and resource mobilization, restructuring if necessary, and recruitment, and will be guided by the resolution adopted during the special session. Chair, this brings me to the first of 5 priority areas on which I promised action to the WHO African Region ministers in Cotonou at the Regional Committee in November. Improving health security by tackling epidemic-prone diseases, emergencies, and new health threats. Tragic as it is, this Ebola epidemic provides an opportunity for the world to take action and progress towards achieving robust national health systems that are adequately staffed and financed, that are resilient to shocks and health threats, and that are able to reach all people with good quality preventive and curative services. And within this is the need for better preparedness to confront and deal with outbreaks of communicable diseases and emergencies due to other hazards. Today's interconnected world demands that countries work hard to live up to their commitments within the international health regulations, and that international solidarity be central to addressing collective vulnerability. The readiness of the African region to deal with health threats within the framework of the IHR is profoundly in need of additional investment and strengthening, and we will pursue fundraising for the African Public Health Emergency Fund, which was established by the Regional Committee and endorsed by heads of state at the African Union Summit in July 2012. We will ensure its appropriate fit within the Global Contingency Fund proposed by the Special EB session. This outbreak has also highlighted the need to mobilize hitherto untapped African capacity to be ready to deploy as part of the surge capacity for epidemics and emergencies. And I shall promote and support the establishment of a multidisciplinary African Health and Emergency Corps within the framework of the Global Public Health Reserve Workforce in collaboration with our headquarters and partners. We shall also work very hard in driving progress towards equity and universal health coverage in our region. We will start by providing support to the recovery of the health systems in the Ebola-affected countries. However, I'd like to emphasize that most countries in the African region need intensive and sustained support to strengthen their health systems. I'm excited by the determination of the global health community to tackle this long-standing barrier to improved health in the region. I also believe that the commitment expressed by our member states, translated into increased domestic investment in health and sound national health strategies, and accompanied by the support declared by international partners, will deliver the progress that has been desired in the past decade. I eagerly look forward to leading my colleagues in the region to work on this. Chair, we will also support the work to ensure that the MDGs are concluded while pursuing the post-2015 development agenda. At the same time, we'll need to tackle the growing burden of NCDs and to ensure that they don't replace communicable diseases as the major cause of ill health in the region. The African region played a leading role in the negotiation of the Global Tobacco Treaty, and now we aim to build on this, focus on prevention, and avert the looming NCD epidemic. We will also support our member states to improve the ability of the ministries of health to tackle the social determinants and work successfully with other sectors in promoting health. Finally, building a responsive and results-driven WHO Secretariat in Africa will be central to my term as regional director. Much has been said about WHO's reforms in relation to the Ebola epidemic response, and my task is to take the reform agenda forward, and the intention is to fast-track, with support from our headquarters, certain key areas of reform. We must build our organization to be more effective, efficient, responsive, accountable, and transparent. We will put in place a strong team to take the organization forward in the region, and I will speed up the work to improve our recruitment and performance management practices. Chair, our impact is most important at country level, and I'd like to ensure that our competence is sharpest at that level. We will review the implementation of the reformed selection of WHO representatives and ensure that their skills and leadership capacity are optimally suited to the countries where they are posted. I'm determined to reinforce our accountability for both programmatic results and the management of the resources that you entrust to us. We will train, guide, and monitor the performance of managers and their teams on WHO's new accountability framework, and I intend to lead by example and be personally available for all aspects of this accountability drive. I take this opportunity to reiterate my commitment to working with you, distinguished members of the Executive Board, with our member states, with the Director General, and with my fellow regional directors towards our central objective, the attainment by all peoples of the highest level of health. I am fully convinced that I can count on your active collaboration and support in my assignment as a WHO Regional Director for Africa. Chairperson, I start on this inspiring journey comforted by the fact that a good foundation has been laid by those who led the African region in the past. They have done truly remarkable work, and I'm particularly grateful to Dr. Louis Sambo, the Regional Director Emeritus, for his leadership, support, and mentorship over the past 10 years. I wish him all the very best as he returns to his country and his family. I wish you all a productive and successful Executive Board session, and I thank you very much for your attention. Thank you.
Thank you, Dr. Moeti, for your inspiring and well-delivered statement. I shall now give the floor to the Director General. Dr. Chan, you have the floor.
Thank you, Mr. Chair. Let me also take this opportunity to express my deep appreciation to Dr. Louis Sambo. Louis has spent almost 3 decades of service to WHO, and the last 10 years as Regional Director of the African region. And during his tenure as RD, there has been significant progress in health in the region. He worked diligently with partners and with countries, and there are some extraordinary progress made in the region. And let me just mention a few. The scale-up of ARV treatment for people with HIV. You heard we achieved 12 million now. And also, the region made remarkable progress in reducing child mortality from malaria, from measles, and other killers, polio, and the region is well poised with support from partners for polio eradication. We keep our fingers crossed. And of course, the region is disproportionately affected by neglected tropical diseases. And you have heard that great progress has been made in several diseases in the region. So Louis, I thank you for your long service, for your humility to serve the organization in the last almost 3 decades. When you look at him, he looked young, but he has been in WHO alone for 30 years. Last week, over dinner, a farewell dinner is a tradition of the organization for the outgoing RD after their second term. He was telling us his plan. So this man doesn't want to stop. So his plan for the future is, with your permission, or even without it, I'm going to share with colleagues. His plan is to go back to build a clinic in the home village in Angola, in the village where he was born, and to promote health, to prevent disease, and to provide care. And of course, I'm sure that is only one of the many things he will be doing. So Louis, I wish you long life, I wish you good health, and great success in your next endeavor. Thank you so much for your service to WHO. Chair, if you would allow me, I also would like to say a few words about the incoming Regional Director, Dr. Moeti, with your permission. Rebecca, I didn't know she has a middle name called Rebecca. It's easier for me. I want to offer you my very sincere congratulations.
Thank you.
And for taking on this very important assignment at this juncture. And you come with a great deal of experience. You were elected on your mandate, on your manifesto, and you gave a snapshot summary just now to the executive board members in other countries, the non-EB members, to help them to appreciate on what priorities and what commitment you were elected by the region. I think, there are two things I would like to specially mention. Thank you for improving the gender equity in the GPG. Okay. The Global Policy Group, by now, 7 elected officials, 5 of them are women.
Wow.
As a woman, to work in a very hierarchical organization, life is interesting. And I'm sure you will rise above the challenge. And I can commit to the GPG, on behalf of the GPG members, we will give you our utmost support. But I also would appeal to all member states in this organization to give you the support you need to deliver on your promises. Without that, it's not easy. So in the spirit of solidarity with the African countries, when you are now taking on the new assignment as the incoming RD at a time full of great challenges, but also great promises. We, of course, have high expectation of you. What you have said are truly music to the ears of member states, and these were issues that they have discussed extensively in the special session of the Executive Board on Sunday, but more importantly, under the WHO reform. You have articulated all the important priorities to make WHO a stronger, a better organization. So let me once again warmly welcome you to the family, and I look forward to working very closely with you together with the other RDs and to fulfill our shared commitment to serve this organization and to live up to our constitutional mandate and do a good job as the directing and coordinating authority in health in the UN. We need to earn that. It's not a given. We need to earn it by showing results, by being accountable to our member states and to the people in their countries. On that, let me give you a big kiss.
Thank you.
Thank you
very much.
Thank you, Madam DG. Does any member states, members of the board rather? Thank you, Panama. We will now hear from Dr. Sambo. May I invite Dr. Sambo to address the board?
Thank you very much. The chairperson, the distinguished members of the executive board, the Director General, Dr. Margaret Chan, colleagues, thank you for the opportunity to speak at this occasion. 36 years ago, in January 1978, as a young medical doctor, I had the opportunity and privilege to sit in this room as a member of the executive board over there, next to the delegations of the United States of America and the then Soviet Union. At that time, countries like Eritrea, Namibia, South Africa, South Sudan, and Zimbabwe were not yet free nations. And other African states were still grappling from the challenges of consolidating their emancipation and independence. I remember we were at that time setting the agenda for the primary health care, and we were about to start the implementation of the WHO sixth General Program of Work, starting in 1978. And for the records, we are now at the 12th General Program of Work. At that time, the total WHO budget for the African region was $101 million for the biennium 78-79, of which 55% was regular budget. And that you know, compared with the 1.3 billion biennial budget for the African region today, with the regular budget representing less than 20%. In addition to communicable disease burden in Africa, the communicable disease burden in Africa was extremely high and was severely affecting people's well-being and productivity. For example, river blindness and vaccine-preventable diseases such as measles, poliomyelitis, and whooping cough were very common in African countries. Mr. Chairman, during that board session, important issues such as the WHO's role at country level, in particular the role of the WHO country representatives, and also I remember it was discussed on the WHO's financial capacity to fulfill its role in the International Decade of Drinking Water and Sanitation, 1980-1990. This was discussed. The board also expressed concern about the malaria situation in sub-Saharan Africa in 78, where the disease was especially hitting rural populations in Africa. And the world was giving very little attention to this situation. And you will note that malaria has remained in the Executive Board agenda for close to 4 decades, including this session. We are still discussing about the strategy to improve the fight against malaria. Mr. Chairman, members of the board, the Director General, dear colleagues, as a young doctor, I was inspired at that time and enlightened by Dr. Mahler, Director General's excellent speeches, and was later convinced by Dr. Cannon, the Regional Director for Africa at the time, to work in the area of public health rather than clinical, which was my passion at the time. From primary health care in 1978 to universal health coverage in 2015, I have witnessed several chapters in global health. There have been significant achievements as well as frustrations along the way. In terms of achievements, I have witnessed substantial progress in Africa's health development, particularly during the last 15 years. This progress has strongly been influenced by the Millennium Declaration and its goals. We have seen a reduction in disease burden and improved maternal health and child survival in Africa and in the world at large. For example, I'm very much pleased to report to you that there have been 0 cases of poliomyelitis in the African region over the past 6 months. Although the work is not yet finished, this achievement illustrates the significant strides made in the fight against polio in our region. It also illustrates that when the international community recognizes a public health priority and provides the means to fight against, it's possible to get tangible results. I also went through frustrations, and the most recent being the ongoing Ebola epidemic. Despite our collective efforts, Ebola outbreaks have repeatedly occurred in Africa since 1976 and have been linked to social, cultural, and behavioral factors. The current outbreak has also exposed the weak components of national health systems. It has also brought to light the global inequalities in health and is calling now for improved WHO capacity to respond to global public health threats. In my opinion, the current Ebola epidemic provides a learning opportunity for global health partners, national governments, and communities. The recent Executive Board Special Session on Ebola highlighted this reality. And it's my sincere hope that we will have all learned with this epidemic and will collectively address similar public health events differently. Let me also take this opportunity to pay tribute to all health workers that gave their lives to save other lives. I would also like to recognize all WHO colleagues who were and are still involved in the Ebola response operations in West Africa. The contribution of the African Union and all the international communities, bilateral and multilateral partners, is also highly appreciated. It wouldn't be possible for us to make the progress that we did so far in addressing the current epidemic. And hopefully, it will be part of our public health history. It is a fact that most of Africa's health problems remain unresolved. We need to do much more. It is fundamental that African states invest more in health systems reforms that make them more resilient and adaptive to so fast-changing environments. It's also very much important that the international health financing and partnerships provides more support to African member states to strengthen their national health systems. Today, 36 years after my first contact with the WHO Executive Board, in general, the same type of public health problems persist, and new ones have emerged, making the African health agenda broad and complex. But I remain convinced that the best way to address the African health agenda is through an holistic approach to health systems reforms, which has to be inclusive and more responsive to people's needs and expectations. I want to thank the Regional Committee for Africa and the Executive Board for giving me the opportunities to serve WHO and my continent. I'm leaving during a period of WHO reform, and despite the unfinished Africa's health agenda, I'm optimistic about the future prospects for Africa. I'm happy, very happy, that the leadership of WHO Afro has gone to Dr. Matshidiso Moeti, the new Regional Director for Africa, who was my deputy for 2.5 years. I sincerely congratulate Dr. Moeti for this achievement. I have known her as a very dedicated and highly talented individual. And I'm very confident that through her leadership, the African region will be able to address the challenges and meet the expectations of member states and the Executive Board. I also take this opportunity to thank all the staff of WHO in the African region. They deserve my recognition for their amazing dedication and work delivered in support of member states, sometimes under very difficult conditions. I cannot end my statement without thanking our Director General, Dr. Margaret Chan. Margaret, I have no words to recognize all the support that you provide to me as Regional Director and to the entire region of WHO. I want to thank the Deputy Director General, Dr. Samoa Ba, all the ADGs, and very particularly my esteemed colleagues, regional directors, who over the years have provided me with a rich pool of knowledge and guidance. I thank also the government and the people of Angola for their effective support during my mission in WHO. Let me finally thank the African Region Ministers of Health and the distinguished members of the Executive Board for your very kind words and for adopting resolutions in which you express appreciation for my contribution to the work of WHO. It has been an honor and real pleasure to have served under your guidance and support. And I wish the best for the World Health Organization, and I will continue providing my modest contribution for health of humankind. Thank you for your attention.
Dr. Sambo, thank you very much. The board wishes you good health and success in your future endeavors. Thank you, Dr. Sambo. This concludes the board's consideration of item 14.1. I believe there's a photo opportunity now. Thank you, ladies and gentlemen. We will now consider item 14.2 of our agenda, appointment of the Regional Director for Europe. The relevant document is EB 136/44. I would like to invite our rapporteur, Dr. Manbuk, to read out for the record the resolution adopted by the board during its open meeting this morning. Dr. Manbuk-Jun, you have the floor.